My name is Joe Blumberg. I am the Executive Director of the Men's Health and Wellness Center. I think I have introduced myself a couple of times this morning or talked to several of you. And I want to thank everybody for being here. This is really an important event for us at the Men's Health and Wellness Center in that it gives us the real opportunity to give back to the community. By our ability to provide these screenings and these educational services, we are educating men to take more responsibility for their own health. A lot of times guys are more willing to abdicate the responsibility for making medical decisions to the woman of the house. And it's time that we begin to take more responsibility for what we do. And I have, one classic example for me is the fact that we call men who have been scheduled to have robotic prostatectomies, and you talk to them and you say, you've been given a packet of information, you're about to undergo this surgery, do you have any questions? And they'll say, nope, I don't have any questions. Are you sure you have no questions? Nope, I guarantee I don't have any questions. Helen, do we have any questions for the doctor? Well, that's fairly typical of what we see. But what we're trying to do through the Men's Health and Wellness Center is provide the education and support that men need to handle not only medical events, but chronic conditions as they age. And you're going to see some announcements about what we're doing and how we're doing it during the coming year that are going to give you plenty of opportunity to participate in activities. Some of those are web-based activities. Some of them are going to be opportunities to hear people who are publicly speaking about various subjects that are important to us. And others of those are just being able to come to the website to get the expanded content that's there. We not only have articles that appear, new articles that we can research and that are appropriate to our subject audience, but also we do podcasts. I do Men's Health Radio, and we interview physicians and medical practitioners on their area of specialty. And these podcasts, new material is posted generally every week. So we encourage you to visit our website, which is www.menshealthandwellness.org. The panel discussion that we're about to go through is a subject that all of us have had, I think, a great deal of interest in, and that's the new healthcare legislation and what it means to you, the patient. And our three physicians here are Eugene Davidson, who is the former chief of staff here at St. Joseph's Hospital and has been well connected with this whole subject for some period of time. Scott Barber, who is an orthopedist, and Scott has a very keen interest in this subject matter. And then we have Brian Hill, who is a urologist with the Urological Specialists of America. I'll get it right. Huh?
Atlanta.
Of Atlanta. Of Atlanta. Of America. It's just, it's a matter of time, right? It's a matter of time. Okay. And, I got it. And I am not Herman Cain, by the way. I can tell you that. So anyway, I'd like to start, first of all, by going through the panelists. And Brian, I'll start with you. But if you could just tell us what your association with this particular subject has been, because I know you've been very actively involved doing public speaking, and you've been interviewed by the news media and so on.
My name is Brian Hill, and I am a urologist working with the group here that I guess probably a lot of you all have met here along the way. I will tell you, I got involved in a very kind of esoteric manner, just kind of mentioned something to my congressman with regards to the healthcare reform bill back when some of this process was initially going through, and had some, I guess, an interesting interaction, which in my mind really becomes secondary, but that really was what drove me to kind of start delving into looking at this. The first thing, and I think everybody sitting at the panel would agree with me, and I'll put words in their mouth, everybody sitting here believes that we need or can fix and improve our healthcare system. We all see that's a very important and vital thing for both our patients and for our economy and the world that we expect and want to kind of develop. I was actually personally very excited when this has become to the forefront because it's been in the background for way too long. And I was very appreciative of this current administration that we were able to really kind of drive things and bubble things up to the point where you guys are sitting here on Saturday afternoon listening to three guys sit here and talk about healthcare. So all of us would agree, I believe, that we can improve and can make things more efficient so that we can bring about better care in a more cost-efficient manner. The question, and I guess we'll talk through this, and I'm not sure, we'll kind of see how this plays out. The question is did the healthcare bill that went through achieve those three things that we really focus on and hope for out of legislative change in healthcare? And the three pillars that we kind of talk about are cost. We've heard incessantly that the healthcare system is currently driving us bankrupt as a country. So are we able to control and maintain the cost and even really decrease the cost of expenditures associated with healthcare? But in that same process, while we're doing that, are we able to do, one, maintain quality of healthcare? We believe in, as physicians, our initial oath, our overlying oath of everything we do is do no harm. And so we have to make sure that by any change we do, we're not going to decrease the quality of the healthcare that we can deliver to our patients. And then we also have to make sure that our patients are able to access us. Access, and you'll hear a lot of terms out there thrown around about access. Access does not mean having insurance. Access means being able to go and see a physician. And so we oftentimes have a tendency to confuse access to health insurance to access to health care. So the three pillars, again, we have cost, quality, access, and those are the three things that I think we need to really broach and look at with regards to healthcare reform. And I think the things that we'll probably deal through and talk through as we go through here this session is, have we been able to achieve those three things? Are we being helpful, or are we actually being harmful with some of the processes that and legislation that's gone through at this point?
Thank you. Scott?
My name is Scott Barber. I'm an orthopedic surgeon, and I actually met Brian last year. I've gotten very active in this healthcare reform because, like many physicians, even before this healthcare debate started last year, we knew as physicians that we were sitting on a ticking time bomb. We understood that Medicare reimbursements to hospitals and physicians was already at a loss and was going down each and every year. So basically, for your physician to care for a Medicare patient, they essentially lose money in delivering that care. And we do it because, we're physicians, and it's what we do. We take care of people, and that's why we got into this business. And from a financial standpoint, we were able to do this because we would lose money taking care of Medicare, and we would be able to make that money up by treating people with more traditional insurance. Medicaid is in the same situation. Medicare basically reimburses you at about 90 cents on the dollar. So for every dollar you spend in the care of a Medicare patient, you get reimbursed roughly 90 cents. Medicaid...
Or about 80 cents.
Yeah, and it varies. But Medicaid ranges anywhere from 10 cents on the dollar to 60 cents on the dollar, depending on where you are. Now, with the baby boomers getting ready to retire, you're looking at an enormous volume of patients being dumped into a system that's gone further and further into debt each and every year since its inception in 1965, and currently has an unfunded liability of $38 trillion. So as a physician, I'm sitting there watching business as usual, and I'm thinking to myself, it's not going to be very long now, it's now, that next year or within the next year or two, there will be fewer people paying into the Medicare system than are drawing benefits. And as we all are aware, there is no trust fund for Social Security, there's no trust fund for Medicare, and there's no trust fund for Medicaid. So we really have a problem here. And I got involved when I was sitting in front of my television and I was listening to people on TV making statements like, we're going to shave $500 billion out of Medicare over the next 10 years to help fund this new entitlement of comprehensive government-run health care. And I thought to myself, I'm no neurosurgeon, but that just doesn't add up to me. And then the coup de grace was listening to the president go on TV and making a statement that I make $50,000 to amputate limbs and that I would do it on purpose, that I would knowingly mistreat a diabetic. And for those of you who didn't catch that, that is exactly what was said, that physicians would knowingly mistreat diabetics in order to create the conditions so that we would then have the opportunity to amputate limbs for $50,000. Well, I can tell you as somebody who has had to amputate limbs that you would not do that for $50 million. To have to look somebody in the eye and tell them that their only treatment option is to have an amputation is not a fun thing to do. It's not fun to do the operation, and it's not fun to care for them afterwards. We also get reimbursed $800 to do it, okay?